we have to switch our fuel source essentially from gasoline to jet fuel. We have to switch from glucose to ketones, because ketones, we can use ketones for fuel without estrogen on board even.
Welcome to the JJ Virgin Lifestyle Show with celebrity nutrition expert, fitness Hall of Famer, and 4-time New York Times bestselling author, JJ Virgin. JJ is a warrior mom whose knowledge and expertise have helped change hundreds of thousands of lives with over 3.5 million podcast downloads and appearances on Dr. Phil, Dr. Oz, The Today Show, Rachel Ray, Larry King Live.
Whoa. This show is about you, not about me. I want to help you find practical, real-world ways to dial in your health and mindset so you can finally lose that weight and feel strong and energized. Stop settling for less than your personal best. It's time to find out how to look and feel better than ever. And I'll be right here with you the whole way. Hey, it's JJ, and welcome to today's podcast. You are in for such a treat. I have a returning guest to the show, one of my close, longtime pals, 10 years plus now. I've got Dr. Anna Cabeca on. I first met her at an IFM certification course, and we became fast friends. And then when my son was in the hospital with a traumatic brain injury, she was one of the first people to track me down, because when she was at Emory, where she trained to be a gynecologist and women's health expert, she met someone who was using progesterone, Dr. Donald Stein, for traumatic brain injury. So she immediately tracked me down and helped me out with that. She's just been a dear friend. She's one of my crew at my 50th birthday party down in South Beach, Miami. We've been all over the place together, and she is just absolutely brilliant. So triple board certified menopause and hormone expert. She is lectures all over the world. She's internationally acclaimed for her work in gynecology and obstetrics, integrative medicine, anti-aging and regenerative medicine. She got the Innovator of the Year award in 2018 at my Mindshare Summit event. And she also got the prestigious Alan P. Mintz Award for clinical excellence at the Age Management Medicine Group conference in 2017. It's, when your peers are shouting you out, that's beyond just, of course, she's changed thousands of lives of women. That just tells you a bunch. And then she's also been formulating some amazing products. She's got her Mighty Maca Plus alkaline superfoods drink and her rejuvenating vulva cream, Julva, which she gave out in my swag bags at my wedding. It was so good. So I am a big fan and a big friend of Dr. Anna Cabeca, and so excited to have her share her new book, The Hormone Fix, featuring the Keto-Green Way today. You're going to love it. And she also has for everybody a masterclass that you're going to definitely want to dive into. And you're going to be able to get that at jjvirgin.com/breeze menopause, because that's what she helps you do, breeze through menopause. I want to do a shout out for another one of my favorites. And this was a 5-star review in Apple Podcasts by Leslie Liu. And Leslie Liu says, favorite as the title. She says, my new favorite podcast. She interviews amazing people and also shares so much of her own knowledge and expertise. And thank you for that, Leslie Liu. Today is definitely another one of those days with an amazing person. And before we dive into that, I want to share another favorite with you. Dr. Anna Cabeca, my friend, welcome back to the show.
I am thrilled to be here with you, JJ. So looking forward to it.
Oh, yes. Well, this is a hot topic. Oh my gosh. We're talking menopause and keto diets. Like we've hit the lottery here. Because I've been getting so many questions about all of this. So you've been on the show before, but I want to just kind of walk it back a little bit. We'll also put in the show notes your past episode, but let's give everybody a little dose of Dr. Anna that I know, the one I know and love so much, who celebrated my 50th birthday with me and is what I would call one of my lifer friends. You, my friend, how the heck did you become this crusader in women's health?
Oh my gosh, trials and tribulation, constant battles. So really, I actually became a crusader, honestly, JJ, because I saw my mom suffering. If anyone's dealt with, caregiving for their parent or have seen them get sick or anyone they love, right? And for my mom, that she was that person. I saw her in and out of the hospital for years. When she was my age now, I can't believe it, honestly. When she was 52, she was requiring cardiac bypass surgery.
Whoa.
Yes. Yeah. That's my age right now. I'm like, shoot, right?
Why? What was going on?
Yeah. So, coronary vascular disease runs in the family, a Middle Eastern population, and then an American diet. And so, say Middle Eastern genetics, I will say, I have the genes, and I do, to survive in the Sahara for 6 months, right? No food, no water, I'll be fine. And so having to learn to now, through her life story too, and her life and her death, because sadly she only lived another 15 years after her surgery, and struggled all of those years. And early on, I was 16 when she was 52. So I was 16, and God knows how she dealt with a teenager while she was going through menopause, right?
You, I'm sure, were just a really nice, sweet, easy teenager.
Oh
Ha
man,
ha.
I know, right? I wish I could say I had not an ounce of rebellion in me. I wish I could say that, but you and I know that's not true. And but I recognize too at that age that, oh my gosh, the research that we're applying to her medical care at that time was all done on men. And I was 16, I was studying, I was volunteering at the hospital, I was working, and so I thought, well, maybe, let me be vegetarian for a while. Well, that didn't really work out well for me. And it just didn't work with me. And it was very interesting to go through and kind of like, what's the science say? What's this say? And so I know that, and that's what I bring in, that experience and life experience. I brought that into my clinical work and my practice, but also, you and I know that we, my personal tragedy and my personal story
Yeah.
threw me into menopause at age 38. And as a physician, JJ, and as a gynecologist, right, a specialist in women's hormones, even at that time, a hormone specialist. And everything I knew didn't work. I was menopausal. I didn't even think like we can actually reverse menopause, especially early menopause, but we can. And I went on to prove that I could do that, right? I had a baby at 41, reversed menopause for another decade, and continued to thrive. And so part of my personal experience, certainly, and my medical and professional experience, brought me into what I do and what I teach and what I've written about in my book. So,
which honestly makes you so much better at it. Like, when you've learned it, studied it, then had the chance to apply it and gone through it personally and then applied it to so many women. I mean, like, wow, it just really changes the game. So let's talk about, what you've seen when women have come in to see you, what they're coming in complaining about, and, how this is really happening hormonally as they age.
yeah, absolutely. And it's what I've experienced twice now. So I'm happy to go through it, right? So, but really honestly, as a patient would come into my office, and I saw this time and time again in their mid 30s, complaining of irritability, worsening PMS, more uncomfortable periods, and especially depression, anxiety. And I would always tell my clients when they would tell me, oh my, like if you only hate your husband 2 weeks out of the month, it's your hormones, not your husband, right? So we have to understand that physiology drives our behavior. But so when we're seeing this period, and now I'm calling it this early period of neurologic vulnerability, when our hormone progesterone starts to drop, as our ovarian function declines, we lose this protective, hormone called progesterone. It's an anti-aging hormone. It's a neuroprotective hormone for the brain and
when
for
does
our
this
moods.
classically start?
So I am seeing this neurologic vulnerability mid 30s to 50. Like I see a 20-year window now. It's like mid 30s to 55, say 30, 35 to 55. And we're seeing this
When should that
transition.
really, when should that really be happening? Because, just like men's testosterone's dropping lower and lower, like we should not be having that happen in our early 30s.
No. I think we've moved it up a whole decade at least.
Wow.
Yeah. And I think back, to so many patients that I've taken care of when their symptoms really started and how that shifted over the 3 decades I've been in practice, right? And practicing medicine. So there has been a shift to earlier and earlier, and the hormone disruptors, the toxins that we know can disrupt our estrogen and hormone metabolism are creating this. But also there's another key component. Like if we overlap this dip, right? This natural, like this early ovarian failure, what I experienced it at 38. So that very extreme, like I had no ovarian function at that time. So that this early decline in hormones, this progesterone withdrawal, is as we're losing progesterone and estrogen during this time, both brain protective hormones. And what's really key to understand is that now why this is extra neurologically vulnerable time period leading to anxiety, depression, mood swings, sleeplessness, our brain's not getting the fuel it needs. So at the same time that we lose these protective hormones, it's our brain's ability to utilize glucose for women decreases. JJ, this just blew my mind when I figured this out. When I looked at the research and tried to understand, okay, well, what was happening to my brain, right? And so what's happening is that utilization of glucose for fuel in the brain is an estrogen dependent process. I believe there's a progesterone component too, but we don't have the research on that yet. So what that means is, in general, let's just compare men and women. Men have 6 times more estrogen in their brain than women. So we
What?
rely on it. Yes, they produce 6 times more estrogen in their brain than women. So as our circulating estrogen levels, we're relying on our reproductive function, our ovarian production of estrogen. And here for our brain to utilize glucose for fuel, to think clearly, right? To have that clarity, we have to switch our fuel source essentially from gasoline to jet fuel. We have to switch from glucose to ketones. Because we can use ketones for fuel without estrogen on board, even.
Mm.
So in this period there's a research article that I just came across that was published in 2016 that looked at this decline of glucose utilization for fuel in the brain of women and symptoms, anxiety, depression, memory loss, brain fog, irritability, all of this at the same time, we're losing progesterone and estrogen, which are protective during this time as well. So this just compounds the issue. And as we're looking at something that women fear most as we're getting older, that's memory issues, dementia, Alzheimer's, the inability to take care of ourselves, we have to recognize that the medications that we as physicians are prescribing our patients to help them through this time period, such as anti-anxiety or antidepressant medications, benzos to get a good night's sleep, like Ativan, Xanax, that increases our risk for Alzheimer's exponentially.
Oof.
Mm-hmm.
All right. So what the heck do we do?
Yeah. So we talk about the hormone fix. Number one, it takes more than hormones to fix our hormones, right?
That is such a great, important line. And I remember early on when I first got introduced to all of this through Dr. Diana Schwartzbein, she said, you have to get healthy to lose weight, not lose weight to get healthy. It reminds me of the same thing. Like you can't just go in. I think people go to a doctor and say, okay, I need bioidentical hormones. And they're stressed out. They're not sleeping well. They're not exercising and they're eating a processed diet. Like what's wrong with that? What happens when you do that?
Yeah. No, I mean that my patients, I would tell them I won't prescribe you your hormones because it takes so much more than that.
That is so
right?
awesome. Like that to me just shows your courage and integrity that you do that because you're just setting them up to fail. So it takes more than hormones to fix your hormones. What does it take?
Yeah. So, one, the Keto-Green Approach, right? And that's where it leads us into there's more to the keto story. This whole brain function thing, this clarity where I went from brain fog. Oh my gosh, JJ. So I'll tell you this. You remember like when I hit menopause my second time, 48, and I was having some real brain fog issues. And I was really at this cycle down. I was hitting it again. I was, relying mostly on my plant-based functional food diet, right? But getting a lot of glucose, not getting ketones. And so I had this brain fog, and it just led me to make some really poor decisions. You remember when I was engaged?
Yes, I do. Oh, I can't believe you brought that up. That's so funny. But I can list out some poor decisions made on my part too. So, happens. We can all forgive ourselves now. Now we know why we've done some of these ridiculous things we've done. There, I feel better.
I feel better. And before I make any big decisions in my life, like I fast for 3 days. I get real keto-green. I get alkaline. I go into a fasting state, and
maybe ask your
I want that
girlfriend.
clarity. Yes. Oh yeah, that's right. It takes a village. We have to have that community.
Oh, totally. As an aside, Anna, before my second date with Tim, my husband, was a group date with what I call the board. So,
nice.
Yes, that did not. I finally went, you know what? I'm not so good at this. I think I'll just make everybody vote. So, yep, that's how that worked.
That's so smart, right? Because sometimes our picker's broken, or our physiology is driving our behavior.
Yeah, so it's
attraction,
our hormones
exactly.
make boo-boos. Okay, so sorry. Back over to this.
But this is so important. That is important. That's life, right? That's the quality of life. And to recognize that, that we don't do it, we don't have to do it alone. And when we do, we often make more wrong decisions.
Mm-hmm. Yes, super important. So you have the Keto-Green Approach, which I loved the name of. The minute I heard it, I was like, oh my gosh, Anna, that is so awesome. Let's talk through what this is, how you use this to help women going through menopause, not go crazy and not make really dumb decisions.
Yes. Yeah. And you should love the term keto green, because you helped me come up with it. Cause I'm like keto alkaline. And you're like, what does that mean? I'm like, well, we need more greens. And you're like, then call it keto green. And I'm like, okay. Brilliant, JJ.
It's so
brilliant.
hard to see it's like when you're in the picture, it's impossible to see the frame, I think, or when you're in the frame, it's hard to see the picture. One or the other of those, anyway.
Right. Yes. Yeah, I get it. And so what was your question?
Let's talk about this Keto-Green approach, like what you've done with a ketogenic diet to make it a better diet, and how this works in menopause to help you get through menopause without, again, making silly decisions and being able to think straight.
Yeah. Good. And to be able to enjoy your life, right? And to, have fun with this transition time period, right? Menopause is mandatory. Suffering is optional. That's really important to just hear.
Yeah. I love that you said that too, to have fun with this, because I will tell you, I now am having, I wish we could have just been here. Like, isn't this a great time? Like, couldn't we just all freeze here now? Because we're having a great time, and a lot of things that used to bug us, we realized how silly they are, and now it's awesome. But if we can help people get through that suffering piece, and know they don't need to, and know that, again, if you do need to look at bioidentical hormones, the first step really is your diet and lifestyle before you ever go there. You cannot balance hormones with hormones without looking at your diet and lifestyle. So that's where the Keto-Green Approach comes in. So let's walk through it. Walk everybody through it. Now, I will tell everybody too, we always do our great show notes, so you'll have all of those, but also Dr. Anna has a master class for you for free. And you are going to get this masterclass at jjvirgin.com. I'm looking at my paper to make sure I get it right. /Breeze Menopause. And you will get the Breeze Through Menopause masterclass. So jjvirgin.com /Breeze Menopause. But I don't want to make people wait. You'll be able to get the masterclass. She'll walk you through everything. But let's just talk about the Keto-Green Diet and what it is and how it helps here.
Yeah. And it's what I recognize that is absolutely necessary during this period of neurologic vulnerability, this transition period when our hormones are shifting, right? When we are struggling and suffering, we're starting to not feel, we're not having the fun that we need to be having. And so what has to happen is we have to work on this alkalinity piece first. This piece of, so when I always describe alkalinity, I think, okay, we are designed to live in nature. So think alkaline, the Amazon, and acidity, a city like New York City, right? big contrast, right? We need, both are fun, but we really need to honor our design, and we can never beat Mother Nature. So getting that alkaline piece in, and a low carbohydrate, because remember, we can't use glucose real well for fuel in the brain when our hormones have shifted. So we want to use low carbohydrate greens, check our urinary pH to get that alkaline, and then only then do we bump into the strategies, lifestyle and dietary, to bring us into ketosis. And that's needle moving. That just shifts the entire, your entire experience here. I mean, that getting that clarity, getting energized, having fun, having that peace inside internally, like not being so moved by circumstances or others, that comes from a very balanced, solid physiology, and getting Keto-Green helps that. So the alkaline piece is that plant-based piece, but it's not just the diet, it's the lifestyle. So it's meditation, it's mastering cortisol, and that's a key hormone that I teach about mastering through this Keto-Green approach, as well as the hormone oxytocin. So doing activities that decrease the cortisol and increase oxytocin, that also helps helps us get alkaline. We can check our urinary pH and see the difference. So that's fascinating because high levels of cortisol will create acidic urinary pH. And let me just tell people that use it as a monitor to help you figure out in your life what's working for you and what's working against you.
Yes,
easy.
That's really important. What we'll do is we will put in the show notes the link to your keto strips that can also do, because you've got the strips that look at both keto and pH. Right?
Yes, because I was too lazy to use two separate strips, so I had to put them together.
You're so smart, Anna. So we'll put the link in the show notes for those as well. And it is very important. You brought up something that I've never heard anyone talk about before. And where I first started to see it is I'd see people with this amazing diet, like eating low carb, lots of plants, healthy fats, clean animal protein, big fiber. So, and one of the key things that plants can do is offset the acidity of animal protein. They were doing everything right, but they were having high blood sugar. And then they'd be acidic. I'm like, what the heck is going on? And it was all stress. So I'm so glad you brought that up, because what's so important to understand is you could be eating perfectly, but if you're under a ton of stress and not doing anything, we're going to have stress. I mean, it's like, it's not like you can go, look at the two things where, you lost a child, I nearly lost a child. It's not like you decide not to be stressed by this. You're going to be stressed, but you've got to have those strategies on board to help you handle it, because it's going to reflect back on everything. So that you brought up a really key point here, is that this is one of the ways you can really start to connect the dots, which is so important. We've got to be health detectives, connect the dots of that fight you just got in and what happened to what threw you out of being, acid alkaline balanced, right? I mean, boom. So then you can put the strategies in place, whether it's meditation or tapping or, burst training, whatever it is that helps you handle it, which I think is different. I always say yoga stresses me out. And I'm a failed meditator. I still will do it occasionally because I love Emily so much, but I'm a better tapper than a meditator. So we got to find our thing that can help you do it. So that is super key. So we're going to put in the show notes the link to the masterclass and the link to get those strips so that you can really see, because what you've done is basically taken, a diet that a long time ago could have been the diet soda, pork rinds, butter and bacon diet, and turned it into something with a lot of good, healthy greens, and as a way that we can cycle in and use this to help with brain function and help with some hormone balance. So that's what you're going to get in the masterclass, the Breeze Through Menopause Masterclass. Again, that's at jjvirgin.com/Breeze Menopause. /Breeze Menopause. And I am so excited that we are going to be hanging out together here in a couple days too. I can't stand it.
Me too. I look forward to it. Yes. Looking forward to every opportunity.
I know. And we did a live for everybody listening. You'll definitely want to we'll put into the show notes too, my Instagram and Facebook handles, because we did one live with Dr. Anna Cabeca, and I'm sure we're going to be doing another one because I get so many questions around this. So we'll have to get that dialed in there too. And thank you so much for being with me today. It is always awesome. However I have to do it to hang out with you, it's always amazing and awesome, and you're so brilliant.
Oh, likewise. Love it. Thank you.
Now, after the break, I'll be answering a listener's question, so stay with me. This is the time where I answer a listener's question. Now, hopefully you're hanging out with me over at Instagram at jj.virgin and Facebook at jjvirginofficial for a couple of reasons. Number one, that is where I jump in and do lives and answer questions. So super fun. And I've also been bringing on a lot more guests. So just did one with my buddy Shalene Johnson, and one with Dr. Mark Hyman, and one with Dr. Anna Cabeca. You get the idea. You don't want to miss out on those. So be sure to jump on there, like it, so that when I show up live, you can jump on in and ask your questions live. And that's where I pull a lot of the questions for the shows, is I grab them either out of my private membership community or from my lives. And this one from Diana is perfect for this show today. And she said, I do so well on my diet. And I know I've been following the sugar impact diet and getting the sugar out, and it's all good until, and I'm just going to say that hits the fan. When I get stressed, I grab the sugar. What do I do? Help! All right. So I'm just guessing Diana's not the only one. What do you think? And so that's why I wanted to address this. I always like to do things that a lot of people can relate to. This is definitely one of those. And here's the thing. You got to put some alternate tools into your toolbox to manage stress, because right now you're getting stressed out and you're grabbing for the sugar, because what happens when you get stressed is your blood sugar goes up and then it goes down, and then your serotonin also goes down. And so your body goes and reaches, it's a natural response to want to go get more quick energy to run from the tiger. And it's a natural response to grab the carbs to boost the serotonin in the brain. So don't beat yourself up about that, but let's look at what we can do to turn this around and lower your stress response. Because I think part of it is, hey, yes, we want to minimize these more stressful situations, but these happen. And when you look at life, it's not avoiding stressful situations. It's being able to handle them. It's being resilient. It's being able to have great stress tolerance that really separates, people who can be successful, because success really to me is being able to handle higher and higher levels of stress. It doesn't get easier. We get stronger. And so what are some of the things you can do? And some of these were part of my Warrior Mom book. These are things that I did in the hospital to handle it when my son was hovering between life and death. And, we just kept getting more bad news, seemed like every day. And so part of it is starting out the day and being grateful, no matter what's going on. You woke up, so you got something to be grateful for, right? And then also having some tools in there. My favorite tool is tapping. And I'll put a link in here to Nick Ortner's tapping solution. So that's definitely one of my favorites. Meditation, Ziva meditation from my girl from Emily Fletcher is another one that works well for lots of people. The other one I really love is burst training. And right now I've moved into a condo in Tampa as we search for where we want to live when we grow up. And so I've been using my Exciser a lot. We'll put a link in the show notes for that. And I love my Exciser because you can literally burst anywhere, but that's one of the ways to train your sympathetic nervous system to handle stress better. So again, you've got to find those things that work well for you. My other one is a hot bath with Epsom salts and a really cheesy novel. There, I said it, like those chick lit novels, those. I admit to it. Don't ever check my Kindle. You'll be appalled. But that's what I do. Totally helps. So find your things that help. And because I can tell you, reaching for the sugar doesn't help. It's a short-term fix and a long-term fail. So we want to skip that. But you've got to have something in place, because nature hates a vacuum. So if you just go in there, I'm not going to do that. Well, come on, you're going to do it. So let's avoid that. Let's find some alternate activities, and let's win this one. All right. See you next week.
That's all for this episode of the JJ Virgin Lifestyle Show, which marks another step towards a healthier body and mind. Don't forget to rate, review, and subscribe to the show, and we'll talk to you next week.